मैंने कैंसर की वजह से अपने चाचा जी को खोया है। वो आर्मी ऑफिसर थे, 45 इयर्स के थे। आर्मी से रिटायर होने के बाद वो घर आए। घर आने के बाद उन्हें खाने में दिक्कत हुई, खाना नहीं खाया गया उनसे। इलाज के दौरान उन्हें पता चला कि उन्हें कैंसर है, थ्रोट कैंसर है। उनके एक्चुअली फादर को भी कैंसर था। उन्होंने अपने फादर पे बहुत सारा पैसा लगाया कि लेकिन लास्ट स्टेज तक कैंसर सही नहीं हुआ उनके फादर का। एंड में उनकी डेथ हो गई। इसी डर के चलते उन्होंने लास्ट में सुसाइड कमिट कर लिया। मेरा पैसा भी लग जाएगा और मैं सही भी नहीं होऊंगा, लास्ट में मरना मुझे भी है, सिर्फ इसी डर से उन्होंने सुसाइड कमिट कर लिया।
Hello and a warm welcome to our fortnightly show, The Pulse. I'm Neelu, Vyas. When you scroll across the social media or news channels or even listen to the radio, an often shocking news item that shakes one out of slumber is the news of celebrities like Bollywood stars and even politicians dying after battling a long stint with cancer. The most recent news being that of former Chief Minister and also the former Defence Minister of the country, Manohar Parrikar. Not only the celebrities, but even around your own close circuit of friends and relatives, one gets to hear of rising cases of cancer. Why is this deadly disease on the upswing? The WHO data says that India will have about 1.16 million new cancer cases this year, and more than 50% of these will be diagnosed in women. Cancer is the second biggest killer after the cardiovascular diseases. So what are the challenges when it comes to cure and care for cancer? How can we boost the infrastructure? And what's the status of the recent research and innovations as far as cancer is concerned? Joining me now is Rekha Gulabani. She is the Director Resource of Indian Cancer Society. I welcome you on the show. Next to her is Dr. P.K Julka, Senior Director, Max Healthcare, a veteran oncologist. Welcome on the program. Next to him is Sudhir Gupta. He is the Additional DDG, Ministry of Health and Family Welfare. And also joining us on the program is Lalitha Kumaramangalam. She is the former chairperson of the National Commission of Women. I welcome all the panelists on the show. And I also welcome this brilliant audience of cancer survivors who've battled cancer, and they are here with their messages and their queries and the problems which they have faced as far as the cancer treatment in India is concerned. But I would throw the floor open today to Dr. Julka, and coming to you with a very direct question, how worrisome are the figures really for India?
These figures are worrisome because the infrastructure what exists at present in the country, we need to do more in that. And we are concentrating on treatment of cancer. Every time, whenever we think, I was a part of, in the Health Ministry, National Cancer Control Program. Government is doing a lot on this non-communicable disease, especially cancer. But still, it is not enough. Whatever we are opening up national cancer centers, regional cancer centers, we are opening up more cancer registry so that we get the figures, but the total figures are much less than whatever the incidence is.
Okay.
So incidence is much more.
Okay.
So what I want is that government is doing a lot, but all of us, should contribute to this, because we should not say that only government will do it, or, we should also contribute to that, and we should open more cancer prevention centers. I was very happy to know about Ayushman Bharat. That scheme, partly that scheme has insurance scheme. That is very good, because everybody should get insured, especially for whatever amount. There it is 5 lakhs. And they have health wellness centers also.
So that covers cancer as well.
That covers cancer as well. And wellness center means prevention of cancer, awareness about cancer. So more the people are aware, they will come in early stages, less costly treatment, and they will get treated and cured of cancer.
But as far as data gathering and the cancer registry is concerned, the international journals, they report certain figures. Then from the Indian side as well, we have certain figures. So whom does one really believe, and how serious is the situation? Of course, India is amongst the countries which still have a low incidence of cancer. But I mean, which is the credible source?
We have Indian Council of Medical Research, ICMR. It's a nodal big agency, and they are having registries for last 4 decades, and they are giving very good data, and worldwide they have a respect for that, and 10% population is covered. 10% population is actually seen the incidence, prevalence and mortality and various other things. Right. There are 2 types of registry: population-based cancer registry, hospital-based cancer registry. In population-based cancer registry, you take a sample of the population. In that sample, you see how many cancer cases occurred, how many died, etc. Right. In hospital-based registry, anybody coming to that hospital is seen. Right. So in a hospital, patient can come from far. So that will tell you about whether the patients are coming in the advanced stage, what is the staging of the disease, what is the treatment follow-up and survival studies. Right. So that is hospital-based registry. We have 29 population-based registry, 29 hospital-based registries. And as per the ICMR data, that is a very good data. International agencies, they publish with their own resources, right. They often quote the published material. They may not take the ICMR. We take the ICMR data practically every fortnight or every month. Right. So in that, actually 15 lakh patients are coming every year, new cases, 15 lakh, 1.5 million. And prevalence is 38 lakhs or 3.8 million. Right. In the prevalence, they take new patients till 10 years. Right. One who survives 10 years, those patients are not taken into account. Right. If you take into account that, it will be number will be more. Right. So in the prevalence, it's 38 lakhs and mortality is about 7 lakh. Okay. And sometimes it is 7 to 8 lakhs.
So this data does go to show that people are getting more aware and they are going to the hospitals, getting themselves diagnosed. But Lalitha, I would want to ask you, what about the rural areas where so many cases which do not get reported? Now, is that not a very big challenge when it comes to data gathering as far as cancer is concerned?
It is, but it's principally because there's such low awareness about cancer. Okay. And if you're talking about specifically cancer in women, traditionally, socio-culturally in this country, women don't look after their health. There are many mindsets that need to change in this country with regard to women, and one of them is this. You will say that, I mean, if you ask Dr. Julka, will reconfirm it for you, that the earlier you're diagnosed, the better your chances of survival. Also, the lower the costs of your treatment. Right. Now, these are not things that are generally spoken about. And there are too many false, wrong beliefs around cancer, which prevent people from actually testing themselves regularly after a certain age. Okay. Whether it's cervical cancer, whether it's why one gets cancer or does not, how to deal with it. And one of the biggest things is that if you talk about it or mention it, you'll get it, which is not true. The other also is that there are too many superstitions around health, generally in India, but now specifically about cancer. Cancer kills, yes, but not always. That's one of the biggest takeaways that I have had from this. Because when I was diagnosed, I was 2nd stage. And I had never really, I mean, I was not an uneducated woman who didn't have access to funds or hospitals or was not, or, you know, anything of that. But the tendency is to take yourself for granted. I was in a very high stress job, yes. But that can't have been the only reason. Right. Fortunately for me, I caught it in time, and I had...
And you had which cancer?
I had breast cancer, okay. 2nd stage. And I had access to treatment. Okay. So these are 2 things that you have to know, and you have to go early, look after your health from a young age, and there's no need to feel guilty about it. And second is that you need to go for treatment immediately.
Right. But you're dealing with so many cancer survivors. You're running an important platform like Indian Cancer Society. What do you think is the biggest challenge when it comes to cancer treatment in India?
Where cancer treatment is concerned, actually, first thing people feel cancer means death, which is not true. Where survivors like her and like me and there are others who in our society, we make our survivors and caregivers to go to hospitals and talk to patients. And we also talk to society also. We go to the community, to the jhuggi jhopdis and to the slum areas and remote villages and tell them that we are survivors. That gives the people hope that even if we report cancer, we will get cured. So if given that support and hope, people will come forward for the treatment. Otherwise, they feel cancer means death. Secondly, I think the major cause is of not having treatment is unawareness, not being very much aware, and denial. Then they don't want to come out of their comfort zone because they feel if I go for test, supposing it comes out to be positive, then I will have to go to the hospital, then such a long time, and I am looking after the family. Even the whole family doesn't want the woman to go out because that disturbs the whole household. If she goes for treatment, who will look after the household, who will look after the children, you know. So she always takes the back seat. She's never paid attention to. They are superstitious also about it. They feel even if we hear the word cancer, we will get cancer. We, as an NGO, go to remote places, to the remote villages. We have taken up a few projects. One of them is in Vrindavan. We go to the remote villages, talk to the women. We don't use the word cancer.
Okay.
We just tell them, sit with them, we talk to them. Whenever we went over there, we took our screening van over there for pap smear and all. We said that, you know, you can be screened. Women said, no, we don't want to be screened because you will find out some or the other disease in me. Then we say, okay, only maybe 20, 25 women will come. So I will, or our volunteers will make them sit. We will tell them, ask them about their sexual problem, about their other problem, their breast problem.
But you never use the word
problem.
cancer.
Never use the word cancer. So we give them symptoms. Do you feel this? Do you feel that?
Okay.
So the women come out. Yes, I have got this problem. The other woman will come out. And then they will call their friends also, mother-in-law, mother, sister, Dharani, Jethani. Everybody will come together and they'll say, I say, all of these problems may be sorted out if you go for pap smear.
Right.
Is it? Then those people will be ready. They will go home, and after that there were 120 women who came for screening, and still there were 20 women who had to be screened. So next time when we go, we will. So we have to coax them, we have to convince them, we have to, we have to tell each and everyone कि जैसे सिर्फ ख्वाहिशों से आरज़ू के फूल नहीं खिला करते, कर्मों की डाली को हिलाना पड़ता है. अंधेरों को कोसने से कुछ नहीं होता. अपना अंधेरा मिटाने अपना दिया खुद जलाना होता है. So everyone has to look after oneself.
Absolutely.
Don't expect anyone else.
But these taboos and this reticence which you're talking about is there in the minds of the women. I would like to go to the people sitting here in the audience. You are either battling some sort of a cancer or you've had some kind of a family history as far as कैंसर इज कंसर्न. मैं आप लोगों से सुनना चाहती हूँ कि मन में ये क्या हिचक रहती है कि आप कैंसर के बारे में क्यों नहीं बात करना चाहते.
मेरा नाम अंजू है और मुझे इस बारे में बात करने में कोई हेजिटेशन नहीं है. मैं एजुकेटेड हूँ इसलिए मैं बात कर सकती हूँ. और कैंसर का जो डर है मुझे नहीं लगा क्योंकि मैं थोड़ी अवेयर थी इन पीपल के द्वारा, इसलिए मैं थोड़ा हेजिटेट नहीं हुई डॉक्टर्स के पास जाते हुए. और मेरा ट्रीटमेंट बहुत अच्छा हुआ है और अभी मैं मेडिकेशन.
आपको किस चीज़ का कैंसर है?
ब्रेस्ट कैंसर था मुझे.
अच्छा. और किस स्टेज में डिटेक्ट हुआ?
सेकेंड स्टेज
में.
जी.
ओके. कोई और आप में से जिसके मन में थोड़ा हिचक रही हो, फिर किसी तरह से जब अवेयरनेस बढ़ी तब आप सामने आए बोलने के लिए, क्या मन में वो हिचक क्यों होती है? मैं वो रीजंस जानना चाहती हूँ.
माय नेम इज़ सुदेश. एक्चुअली क्या है कि सबसे पहले तो ये होता है हमारे मन में, जैसे सपोज आई बहुत अच्छी फिगर है तो डॉक्टर ने बोला कि ब्रेस्ट इज़ रिमूव्ड, तो आई एम नॉट प्रिपेयर्ड. देन आफ्टर सम टाइम माई सिस्टर, माई रिलेटिव्स, दे इंसिस्ट. आई गो टू डॉक्टर प्रोफेसर जुल्का. इन्होंने मुझे बहुत मोटिवेट करा तो मेरी समझ में आया. तो देन आई वाज टोटली प्रिपेयर्ड और तब मेरी 4th स्टेज हो चुकी थी. अब
इस चीज़ से हिचकने की ज़रूरत नहीं है क्योंकि अब प्रोस्थेसिस अवेलेबल है मार्केट में. यू नो देयर आर एंड पॉकेटेड ब्रास आर देयर.
वो अपने मन की हेजिटेशन बता रही है कि क्या था. हाँ बोलिए.
या तो लास्ट ईयर आई वाज अगेन डिटेक्टेड. फिर लंप हो गया तो फिर से अनुराग सर ने मुझे बोला कि आप सर्जरी करवा लो.
ओके.
तो फिर आई गो फॉर सर्जरी.
तो ये एक तरीके की मिथ है जो आप कह रहे थे कि अगर ब्रेस्ट रिमूव किए जाएंगे तो शायद बॉडी का शेप खराब हो सकता है. कोई और इस पे बात करना चाहेगा? कोई और किसी और तरीके की मन में हिचक या हेजिटेशन? हाँ बोलिए.
हाँ, मेरा नाम अनीता है. मैं ब्रेस्ट कैंसर 3rd स्टेज थी मेरी 2014 में. तो मैं एम्स आई, तो मैं रोते रोते गई घर से। एक बहुत सारे क्वेश्चन थे, परेशानियां थी, डर था कि लोग क्या कहेंगे, लेकिन रोते रोते मुझे एक ऐसा इंसान मिला जो मुझे डॉक्टर झुलका के पास ले गए, इनके सीधा ऑफिस में। तो इन्होंने मेरी सारी रिपोर्ट्स देखी। तब भी मेरे मन में डर था कि मेरे लिए तो एक नई चीज़ थी, लेकिन इनके लिए आम था, ये ट्रीटमेंट इजी था ये। तो मैं सोच रही थी कि डॉक्टर कहेंगे कि क्या ब्रेस्ट कैंसर है, एक डर। लेकिन मैं जैसे डॉक्टर से मिली तो डॉक्टर ने मुझे यही बोला, आज आप रो रहे हो, एक दिन ऐसे आएगा आप हंसते हंसते घर जाओगे, ये मेरा वादा है, आप निडर हो जाओ। फिर भी मन में बहुत सारे क्वेश्चन थे। फिर मेरा ट्रीटमेंट शुरू हुआ डॉक्टर विष्णु के, उसमें डॉक्टर राजेंद्र प्रसाद, वहाँ मुझे मैडम रेखा जी मिली। उन्होंने मुझे मेरा माइंड वॉश किया कि अगर ब्रेस्ट रिमूव होती भी है तो उसके बहुत सारे वो हैं, तो इसमें आपकी पर्सनालिटी डेवलप ही होगी, आप नीचे नहीं गिरोगे। तो मुझे एक मेरा हौसला बढ़ा। तो
और
मुझे
आपको अब आप इस समय कोई डर नहीं है आपका?
नो,
आप बिल्कुल फिट एंड
और
फाइन
मैं
है?
आज अपने जनकपुरी एरिया में छोटे से ही उसमें पार्क में योगा के थ्रू सबको अवेयर करती हूँ।
वंडरफुल। अच्छा,
मुझे
ये
खुशी
तो रही
मिलती है।
ब्रेस्ट कैंसर की बात। मैं प्रोग्राम के पहले कुछ लोगों से बात कर रही थी, एक बच्ची थी जो मुझे एक ओरल कैंसर के केस के बारे में बता रही थी। आपसे सुनना चाहेंगे कि किस तरीके की बैटल आपने अपनी फैमिली में देखी है, क्या था?
मैम, मेरा नाम ज्योति शर्मा है, मैं जर्नलिज्म की स्टूडेंट हूँ। मैंने कैंसर की वजह से अपने चाचा जी को खोया है। उन्हें, वो आर्मी ऑफिसर थे, 45 इयर्स के थे। आर्मी से रिटायर होने के बाद वो घर आए। घर आने के बाद उन्हें खाने में दिक्कत हुई, खाना नहीं खाया गया उनसे। वो चंडीगढ़ हॉस्पिटल गए। इलाज के दौरान उन्हें पता चला कि उन्हें कैंसर है, थ्रोट कैंसर है। उनके एक्चुअली फादर को भी कैंसर था। उन्होंने अपने फादर पे बहुत सारा पैसा लगाया ताकि उनका कैंसर जो है सही हो सके, लेकिन लास्ट स्टेज तक कैंसर सही नहीं हुआ उनके फादर का। एंड में उनकी डेथ हो गई। इसी डर के चलते उन्होंने लास्ट में सुसाइड कमिट कर लिया कि मेरा पैसा भी लग जाएगा और मैं सही भी नहीं होऊंगा, लास्ट में मरना मुझे भी है। सिर्फ इसी डर से उन्होंने सुसाइड कमिट कर लिया। मेरा एक क्वेश्चन है कि आज भारत में जो है साइंस और टेक्नोलॉजी इतनी ज़्यादा आगे बढ़ गई है, लेकिन फिर भी लोगों की मेंटालिटी ऐसी है कि वो कैंसर वर्ड से डर जाते हैं। ऐसा क्यों?
बिल्कुल उसी सवाल को हम एड्रेस करेंगे। एंड डॉक्टर जुल्का, one by one, we'll come to you one at a time, please. Yes, Dr. Julka.
There are myths about cancer.
Yeah, I wanted to ask you about this.
That is what I want to tell. Number one, cancer is a death warrant. This is not true. It is not a death warrant. Cancer is as curable as any other disease. I always used to say, you have cough, you have pneumonia, you have other diseases. Similarly, you have cancer. It is curable if detected early. So, the hallmark of cancer cure is early detection, which I used to say, early detection is the hallmark to cure. Now, I'll take an example of breast cancer just for namesake. If you have a lump in the breast, now in India the studies are we see the lump at 4 centimeters in every woman. That is about median. And in Italy they see at 4 millimeter. Now you see 4 millimeter lump versus 4 centimeter lump. Now 4 millimeter, they remove the lump, not remove the breast, and they give radiation, no chemotherapy. And cost is low, costness is maintained, and your breast conservation is there, organ preservation.
Right.
So this is the state of affairs of early detection.
So which means that early detection is required. And so when it comes to early detection,
Yes.
what are the signs and symptoms, Dr. Julka?
Yes.
How does one arrive at the conclusion that maybe, it could be cancerous, or how do you arrive at that conclusion?
Now, that is why more and more young people are coming now in their 20s and 30s. I am seeing girls with breast cancer. Now, what is the reason? We have these hormone receptors, molecular studies are being done. So now what we say, that according to India, don't follow the American Cancer Society guidelines because they are meant for those people. Here what we follow, more than 20 years you should go for breast self-examination.
Okay.
Examine your breast, and if you find any lump in the breast or any lump in the armpit or any lump in the hair, in the neck area, so you always go to the doctor and show him. Don't say that it may not be cancer, but go to the doctor. And if your nipple is retracted, gone back, it may be congenital also, but otherwise if it is retracted, go to the doctor. And if there is discharge from the nipple, go to the doctor. So all these symptoms of breast cancer, I have told you about breast. Similarly, oral cancer, you have a persistent ulcer in the mouth and your teeth are cutting the buccal mucosa here. So then you go to the doctor and get it mended. It may not be cancer. Or bleeding from any site, means bleeding from the mouth or bleeding from the rectum, or in females, intermenstrual bleeding, means not in the menses, in between the menses, bleeding may be there. So that may be your change in voice, it may be a sign of cancer. Not that all will get cancer. So these could be cancerous. So
But Dr. Julka, what about, like you were speaking about men, women, but what about the high incidence of cancer amongst children? A lot of young population now, like 5 years, 8 years or 10 years or even adolescents, they are contracting cancer.
This is basically, we call it a genetic defect.
Okay.
You know, because genes also play a role. There is familial type of cancer, as in breast cancer, we say about less than 10% are familial, not more. But we always talk of BRCA1 and BRCA2, and we have, besides BRCA1 and 2, other genes. You have heard of Angelina Jolie. I always called Angelina Jolie effect. You know, earlier when I was in AIMS, she sent me a mail saying that should I go in for bilateral mastectomy or bilateral oophorectomy, ovaries removed.
Okay.
So I said yes, BRCA1 mutation means that you should get both the ovaries removed, both the breast removed.
Right.
And many people are getting it done. Bravely they are fighting it. Not that their image is spoiled.
But then again comes a larger question of what are the contributing factors? We just spoke about the signs and the symptoms Dr. Julka shed light on. What are the larger contributing factors? Now, there are countries like Australia, New Zealand, which have an incidence of, say, about 779 cases per 100,000. But in India, the figures are too low, but still the trend is very worrisome. So what are the contributing factors according to you?
We must know cancer can occur in any part of body, and right from 1 month till the 100 years it can occur to anybody. Any part means like it can occur in eye, retinoblastoma, about mouth, Dr. Julka said already, it can occur in the pharynx, oral cavity, lungs, bones, soft tissues, and abdomen, any part. So in that, actually in the cancer, there are several factors.
Okay.
It is not only genetic, genetic is one. Some of the cancers are genetic, like the retinoblastoma. There are chances to occur in the next offspring. Similarly, Wilms tumor. In that, the chances are more. But genes play a role. Suppose you have normal genes, even then there can be mutations, and that can lead to cancer. Besides gene, it could be infection, like hepatitis B. Hepatitis B causes the cirrhosis of liver. Inter alia, it can cause liver cancer. So government is having a separate program for that. Hepatitis B vaccine is available under the universal immunization program. Then after the infection, even the HIV/AIDS patient can have some kind of cancer. So for that, we have a program. And then we have HPV infection, which causes a cervical cancer. After the viral infection, in fact, the bacterial infections, chronic infection of any part of body. Suppose you have a sharp tooth and it irritates the mucosa, you can develop a cancer. Then there are common things I will say. Tobacco. Internationally and in India also, it's a #1 killer.
Right.
We had a committee meeting and we classified the different agents. There are several agents. There is an international agency for research in cancer at Lyon, France. In that, they classified 120 agents which definitely cause cancer.
Right.
120 agents. definitely causing. And there are other agents which are possible and probable.
Can I just interrupt you here for a few seconds? Dr. Julka, I've come across many people who say that I don't drink, I don't take tobacco, I have a very regulated lifestyle, but then also they got cancer. Now, how do you answer the questions of such people?
As he was saying, I'll just continue from there.
Right.
That tobacco relates to about 40 to 50% of the cancers,
Okay.
which we have. And we have 15 lakh new cancer cases every year. Now, tobacco is number one. And then alcohol is another.
Right.
And tobacco added to alcohol still adds to more. You know, I used to say that it's not sone pe suhaga, it's karela or dusra neem chada, you know, in a different tone,
Right.
you know, because they are synergistic effect. So you have different HPV infections. Now, human papilloma virus is not only contributing to the cervical cancer, it is contributing to head and neck cancers also
Okay.
in males in US. Here the incidence is much low. In our AIM study, we had about 20% incidence of head and neck cancer due to oral sex.
Okay.
So that is more common in the West, not in the India. So what I mean to say that cancer has multifactorial causes. It's not the, and we have two types of genes. One is oncogenes, which promote cancer, and one is tumor suppressor gene, which is suppressing the cancer.
Okay.
And if there is a mutation in the tumor suppressor gene, then cancer can develop.
So it's not only lifestyle, but it's genetic also, because of
Also.
which you can get cancer.
Yes. So mainly it is a lifestyle disease. People have sedentary habits. The diet is not good because they eat food from outside. I'm not saying that outside food, junk food should be avoided. We are copying the bad habits of West and not copying the good habits.
Right.
You know, staying in front of computer, in front of television, not going for walks, walking every day, half an hour minimum should be there. You know, exercise is a must. I always used to say that diet and exercise play an important role.
Right.
You know, for example, prostate cancer. Prostate has become number 3 in Delhi Cancer Registry. I was in charge of Delhi Cancer Registry in AIMS. So why it has come up? Because of sedentary habits, because of certain prostate is also familial genetic problems, because we are using certain drugs which are PARP inhibitors in prostate cancer also, as we are using in breast
One
and other
question
cancers.
to which I would like to come to you, Lalitha, that it's a fast-paced, technology-driven world. And of course, one has to see the warnings. You have to exercise, you have to follow a regimented diet, despite all these things. But the kind of things which we see at the windows of the big showrooms, it's so easy to just go and pick up things which are full of preservatives. Now, how do you really change your lifestyle completely when all the time, like 13 to 14 hours you're in office, you hardly have time to go home and cook food? So how does one really change the lifestyle then?
You know, it's a question of mind over matter, in fact. If you want to keep yourself healthy and free from risk, you'll find the time. The thing is that we find excuses not to find the time. I did the same thing, and I mean, I almost paid the price for it, but I was lucky. So it's the same for anything. What is that old saying, that where there is a will, there is a way. Now, I was told that, you know, when you eat, today the number of fertilizers, etc., carcinogenic stuff that, or a lot of these medicines and injections, etc., that are given to fruits and vegetables that we may consume. So we need to be careful. One doctor once told me that, you know, the shinier a fruit is or the vegetable is, please don't buy it.
Okay.
Because nature has its own way of showing what is genuine and what is not. And too much credit is placed on the visuals and not what may be inside. I mean, he was likening it to all the fairness creams that we talk about. And that is one thing. The second is that he said that as far as possible, eat healthy. Eat fresh cooked food. Don't keep, I think Dr. Julka also said that when we were waiting outside, that don't keep heating the food and eating it.
Right.
In the olden days, probably because there were no refrigerators, we cooked it twice a day or thrice a day, and that's still the best way to do it. And eat more vegetables. you can't tell people who are diehard non-vegetarians not to eat non-veg, but don't eat red meat as much as, avoid it as much as possible. Eat regular meals.
Okay.
Once I said that, look, I have almost, it's a very sedentary job I'm in, so what do? He said, get up every 5 minutes or 10 minutes or 15 minutes or whatever it is. Walk 50 steps. You'll make your 5,000 or 6,000 steps or whatever your goal is for the day. The thing is that you have to find the way. He said, the analogy he told me was, it's like pani jaise hai.
Right.
Water always finds its way to where it has to go.
Absolutely.
That's how we have to do it. And he said, generally life has become more stressful. He was a cynical man, I think. He said that, people have lost trust in too many things.
Right.
And the mind is nowadays too consumed by negative thoughts. According to him, it's mind and body that we have to learn to deal with.
Absolutely.
And if you think positive, he said, you will find that automatically even yourself would pay more attention, not just to yourself,
right,
but to even just being happy.
Absolutely. So one has to change the mindset, definitely, as you
Yeah.
said. But we've spoken a lot about signs and symptoms, and what are the early signs one has to look forward to. But all these people who are sitting in the audience, you are already fighting a battle against cancer. But as far as the treatment and as far as the infrastructure of cancer is concerned, when it comes to the diagnostic machines, number of hospitals, I want to know from you all that have you ever faced any problems when you went to a hospital, probably you didn't find a doctor or you didn't find a machine, किसी तरीके की कोई प्रॉब्लम आपको अर्ली आई थी जिस समय आपको कैंसर डिटेक्ट हुआ, तो आपसे सुनना चाहेंगे इसके बारे में.
मैम एक्चुअली क्या होता है कि डेट नहीं मिलती सर्जरी के लिए जल्दी से.
अच्छा, सर्जरी की डेट आपको नहीं मिलती.
दिस इज द मेन रीजन.
चलिए, उसका रीजन डॉक्टर जुल्का बता देंगे कि क्यों सर्जरी की डेट नहीं मिलती है. बताइए.
There are more number of patients, who want early dates. So, and doctors are limited, and everybody wanted to rush to AIMS for treatment. So obviously, for obvious reasons, you understand the doctor-patient relationship, the ratio
Right.
is to blame,
Right.
not that.
And this is a
Doctors
very
are-
significant point which you have pointed out, that the doctor and the patient ratio.
Yes.
What is the current scenario? Of course, government is doing enough. More AIMS-like institutes are coming up. Insurance schemes are in place. But still, what still are the bigger challenges as far as the infrastructure is concerned?
Actually, government is trying to build up infrastructure for cancer for about 50 years from now.
Okay.
Since 75, cancer program started. It was merged with the other NCD program in 2010. It is known as National Program for Cancer, Diabetes, CVD and Stroke. It's a common program. And under that, because 40% cancers are due to the lifestyle related, the prevention strategies are same.
Right.
And the treatment possibilities are different, because treatment is by surgery, radiotherapy, chemotherapy and palliative care. We have a palliative care program in the country which is already running. About the surgery, it can happen in the medical colleges. We have now 250 government medical colleges, and of course total is 500, 250 in private and 250 in government side. And health is a state subject, so state government, they do have their own hospital. And in cancer, one thing is fundamental. It is required at each and every step. Like we are opening health and wellness centers in the country. Government is committed to open more than 1 lakh, and the level at the PHC and below, they will be health and wellness centers. So health and wellness will be the key word. It is not that somebody is suffering, then they go. They will be seen for various things, not only cancer. In the cancer also, we have now population-based cancer screening rolled out in the country. And in that breast, cervical cancer and oral cancer, these three are being seen. There is a set protocol which has been given to all states and all.
Since we are talking about cancer, so these health and wellness centers will have mammogram machines, PET scan machines, everything is going to be there.
I will come to that. Actually, there is in the protocol, the cost-effective protocols are there. Like in the oral cancer, it's a visual oral examination. In the breast, it's a clinical breast examination. And for the cervical cancer, it's a VIA technique. Visual inspection with acetic acid. It's a very low cost.
Right.
Mammography is an adjunct tool. It's not the basic screening tool as per the Government of India guidelines.
Right. बट रेखा जी, आप भी तो जब आपने बताया आप वृंदावन जैसी जगह में भी जाती हैं, छोटी जगह पे जाती हैं, आपको वहाँ पे जो इंफ्रास्ट्रक्चर की आपके नज़र में क्या क्या प्रॉब्लम्स हैं इस समय ग्रास रूट लेवल पर?
There are many problems. One thing is to convince the people. Our motto is to fight cancer from all the aspects. Not only talk about treatment, not only talk about, of course, infrastructure, but prevention should be the first step towards it, you know. And we should motivate the healthy people, the people who don't know anything about cancer or these things. We should go and talk to them about cancer and NCDs also, and convince them that tests are very important after the age of 30. They should go for annual checkup. Every year they should go for checkup. Where we go, we collaborate with the hospitals and we ask them to do free or nominal rate tests for the people, so for the healthy people.
Right.
So that even when the symptoms are not there, it is found.
But when you're traveling from one village after another, do we have enough screening facilities? Like, for example, in Tamil Nadu, we've seen there's almost a universal screening coverage which is there. So if Tamil Nadu can replicate, I'll come to you on this question as well, that if Tamil Nadu can do it, then why can't the same model be replicated in other states?
Of course, it can be replicated. The hospitals are very helpful in this respect. If we approach them, they can take their, and then we also have got a state-of-art diagnostic van, where we have got mammography machine, X-ray machine fitted inside the van. We take that van to those places because those villages don't have proper infrastructure, as you said. And but then the problem is we have to get rooms to check the women and all that. So the cleanliness is not there, hygiene is not there. That also has to be paid attention to. We are only talking about cancer, but these unhygienic conditions, they contribute a lot towards cervical cancer also.
Right.
You know, because mostly it is the women who are sexually active get cervical cancer. But where virgins are concerned, they get cervical cancer due to unhygienic conditions. Those also we have to teach these people who stay. We should concentrate more on the grassroots level where people are not aware at all.
Right.
And we should have more such vans like we have, and other few NGOs also have such vans. So we should take these vans to those villages, and we should initiate the hospitals in the locality to go to the people. And we have seen in Vrindavan and other places also, what they do when women come to them for other problems, they check their breast and they say that pap smear is important. And if they find something positive, only then they tell about cancer.
Okay.
Otherwise, if they ask them to come for the test, they will not come.
But as far as the diagnostic, yes, Dr. Julka, you're saying
The
something?
unfortunate part is that even doctors don't come for preventive health checkups. That is the
That's an honest
unfortunate
admission.
part.
Actually, all the
Unfortunate
stakeholders should come together.
Should come
the
together.
NGOs, the doctors, and the government policies, you know,
Because
and the survivors.
We see so many doctors who are coming at stage 4. And if you
Even
try to
doctors.
convince them, you know, absolutely very difficult to convince them.
Yeah, my cancer was diagnosed when I went for my annual checkup. Otherwise, I'd never have known. I had no symptoms, nothing. I was working, I was traveling 20 days a month, working 12, 14 hours a day. There was nothing wrong with me. But then when I went for my annual checkup, they did the mammogram once, twice, thrice. And then they did a spot mammogram. And then, but I was sensible enough to understand that I have to undergo the treatment immediately because my brother had died of acute myeloid leukemia in 2000. So I understood that, you know, you can't lose time.
Yeah. But I would like to talk about a few myths also, as Dr. Julka said.
We'll come to that, ma'am. Yeah.
So, I'd like to tell people that you don't need to be afraid of cancer. Yes, it's costly. Yes, it's a difficult regime. But then any, disease is difficult to go through.
Absolutely.
And you need to learn to trust your doctors and ask as many questions as you want. You know, after the third or fourth chemotherapy, I was given 2 drugs at one time. I told my doctor that, look, I'm going crazy. I can't sleep. In my life, I've never been afraid of the dark and I have to put on the light to sleep. So he laughed and said, ma'am, you have always been in control of your own life. Now you are not in control of your body. So yes, we have support groups available, which are run by, in Max, of course, we have one. And he put me onto that. And the moment you find that there are others who've been through the same thing, your fear goes down.
Yeah.
So we need to talk about it. We need to reach out. Don't be afraid of log kya bolenge.
So I think survivors can help the survivors and get motivated.
Absolutely.
Yesterday we had a program of survivors.
Yeah, but
Okay.
Sister Shivani was there.
Sister Shivani was there, and she talked about the stress, how to relieve stress.
Yes.
So stress is very important factor. So one should relieve. She asked about, why did you get stress One of the survivors told, maid did not come today. So that was the cause of stress. So she said, now maid did not come, you were sweeping the floor, then somebody will come and ask, नाश्ता बनाया कि नहीं बनाया? Then you will give stress to him. Why are you asking me? And then this stress cycle continues. So what I want to tell you.
But from this, you know, it really tempts me to ask this question that application of mental health in oncology, this itself is a very unexplored area. How many people do that?
Very important. You know, as a dean, I started 90 programs in AIMS. 90 programs. One of the programs was on psycho-oncology.
Counseling.
Psycho-oncology.
Yeah.
What is
Somebody
psycho-oncology? We have a counselor in Max also.
Yeah, now,
and
finally.
a very young girl and very good.
But not all hospitals are doing that, I'm sure.
Yeah. Psycho-oncology plays a very important role because you have to tell the patient what you are suffering from.
Right.
Half of the counseling I do myself, you know, and the other half is being done by psycho-oncologists. So that plays a very important role.
In fact, since you've already spoken about psycho-oncology, Dr. Sudhir, my question to you again goes back to the infrastructure challenge which still remains. Like you still are using the three brute forces for cancer treatment, if I could call, that is surgery, radiotherapy and chemotherapy. These are the three basic pillars on which the cancer treatment is still relying in India and of course around the world. But when you don't have enough radiotherapy machines, the diagnostic machines are not there, not enough oncologists and not enough counselors as well. When you talk about introducing something like psycho-oncology, how does one deal with a situation like this? Because obviously it has to be multifaceted, it has to be a multi-pronged approach from the government side as well.
We have a national health mission and which is throughout the India, various programs, they are funded together as a chunk of money which goes to the state government. It goes in the form of the PIP, Project Implementation Plan. It is made 1 year before. And when you talk of cancer, the diagnostic machines are not only for cancer. They are inter alia for several other conditions like the X-ray machines, CT scan, MRI, PET scan. So they are required in any case at medical college or other facilities. So that is being done. We have a PMSSY scheme, Pradhan Mantri Swasthya Suraksha Yojana. 70 institutions have been funded. They have been upgraded, including for oncology. Similarly, we are opening the new AIMS. We have a AIMS at New Delhi. We have a PGI at Chandigarh, JIPMER at Puducherry. We have opened 4 at Rishikesh and Jodhpur, etc.
And the latest one was at Jhajjar, I believe.
Jhajjar is a National Cancer Institute. That's a real pride for India. It is more than 2,000 crore. It is operational now. People can go and see and support also. It is operational. They have a state-of-art lab also. They are having OPDs and palliative care also. OTs are also functioning. Radiotherapy equipment will be by end of the year. So that will be the hub of activity for research and several other activities. So that is really pride for India.
Right. हमने इतनी सारी चीज़ों की अभी हमने बात की.
1 minute I would like to add that when we were planning the NCI project for AIMS, we planned for 400 beds for research and 300 for clinical. More for research because I said
that is very important.
And National Cancer Institute should be on the model of NCI US and we should have more of research facilities because I myself conducted more than 100 clinical trials in AIMS.
In fact, I'll come, you've spoken about an important aspect to which I'll come a little later, but we've not talked about the cost of cancer treatment. अब आप लोग जिनके परिवारों से जिन लोगों को कैंसर हुआ है, कितना पैसा लग जाता है नॉर्मली ये कैंसर का ट्रीटमेंट करने में? आप सभी लोग किसी न किसी एनजीओ से या हॉस्पिटल से जुड़े हुए हैं, तो आपसे जानना चाहेंगे कि कितना महंगा है ये ट्रीटमेंट? एक गांव में बैठा हुआ आदमी या आपके लिए कितना मुश्किल है कैंसर का ट्रीटमेंट?
मैं सुनीता अरोड़ा. इसके लिए कुछ कहा नहीं जा सकता कि इसके ऊपर कितना खर्चा आएगा, क्योंकि अलग अलग हॉस्पिटल में अलग अलग खर्चा आता है और अलग अलग टाइप के कैंसर का अलग अलग खर्चा आता है. तो इसके लिए आदमी कुछ सर्टन नहीं हो सकता कि इसमें आपके कुछ लाख होंगे या बहुत लाख होंगे, तो ये कुछ कहा नहीं जा सकता.
अब जैसे उस लड़की ने बोला कि इतनी सारी 20 से 25 लाख की कॉस्ट आ गई थी जिसकी वजह से उनके अंकल ने सुसाइड कर लिया. डॉक्टर जुल्का, how about getting an affordable treatment?
Yes,
and an equitable treatment as well?
She is right. It depends on the type of cancer. Now, for certain types of cancers, you need, besides surgery, radiotherapy, chemotherapy, you need immunotherapy. Nowadays, immunotherapy is widely being used because in the West, they have told that the data for immunotherapy combined with chemotherapy is much better than chemo alone. So
But according to the Indian standards, it becomes
yes, that is for
unaffordable.
That is for lung cancer. I'll give you one example. And lung cancer, the results are tremendous. They are very good results. Even in stage 4, we get the genomic profile of the patient and which gene is now in stage 4 lung cancer. Earlier, we used to say palliative radiotherapy to be given, that's all, or pain management, palliative care to be done. So nowadays, we don't talk of only pain medication. We talk of, suppose there is a gene mutation, EGFR gene mutation, we have a drug, simple drug, and one tablet a day, people keep on taking for years at home.
So
They
it's just
don't have-
like treating cancer, like any chronic disease like diabetes or heart
so
disease.
what we are trying to do, make cancer a chronic disease like diabetes. Diabetes is incurable, let me tell you. Hypertension is incurable, high blood pressure. So all these diseases, don't think that these are curable. We always say, similar to diabetes, we want to make cancer also a chronic disease, which you take tablets and keep on living.
But Dr.
And
Julka,
living a normal life, good quality of life.
But Dr. Julka, supposing like if the early detection hasn't happened and someone walks in with a stage 4 cancer, say for example of a lung or maybe an oral cancer, is there hope? Is there a real hope for that person?
Yes, there is a hope. There is a hope because a patient of stage 4 lung cancer taking a tablet every day, going to office, going for walks, living with his family, a good quality of life, and he's enjoying life, whatever life he has. You know, it may not be 6 months to 1 year, it may extend to years. And I'll give you anecdotal cases which have lived for more than 5 years. Stage 4 cancer. And one of our patients, a young girl who has a daughter also, and she was referred from US to me. And she is a different type of cancer, but she is living for 10 years on tablets. 10 years.
So basically,
stage 4,
right.
Liver, lung, bones, mets.
So basically, the hallmark of the new research on cancer is a combination of radiotherapy, chemotherapy, drugs, everything all combined. Immunotherapy,
and
of course.
now molecular-based therapies.
Okay.
So molecular oncology is coming up in a very big way.
Okay.
Because, you know, I used to tell them the first lecture on immunotherapy I took in 1979 when we didn't have any drugs.
Right.
So that was only on the lymphocytes, our army, which fights the tumor. You know, those are the white blood cells.
Right.
And now I say we stimulate our army, T cells. You know, the white blood cells have lymphocytes. Lymphocytes are of 2 types, T cells and B cells. We stimulate the T cells and the brakes on the T cells are removed, accelerator is pushed on, and they go and kill the tumor.
Okay.
So this is what I tell them.
But these are right. But Dr. Sudhir, these are all high-end research innovations which Dr. Julka is talking about. And we've seen people traveling abroad. We've seen so many celebrities who've traveled abroad, stayed in UK, America, got the treatment done, and they've returned back with all smiles on the face. Are we going to see smiles on the Indians, on the faces of Indians as well, with so much of research happening in immunotherapy? How do you make it affordable for the people, basically?
Yeah, now the answer will be Ayushman Bharat.
Okay.
The 50 crore beneficiaries will be covered, the 10 crore families, and 5 lakh in a year to the family. So that is being rolled out.
Okay.
So those who cannot get in the public sector or those who cannot afford, they will take the benefit under Ayushman Bharat, which is a cashless scheme. They don't have to pay, and they can go to best of the best hospital also. So that is answer. Already 1400 package rates have been finalized, and if I am not wrong, 33 states are on board, and it is being rolled out. So that is answer. And otherwise, 10 to 15% people are already insured. They have Mediclaim or other things. I think figure is up to 25%.
Right.
They have Mediclaim and CGHS, ESI, railways, and they are, you know, lot of people are already covered. And our middle class is growing the affordability is increasing. So that is the answer.
So if infrastructure is there, affordability is not an issue. Of course, it takes its own time to develop the infrastructure. So one by one, from all the four of you, what I would like to know is that where is the real problem when it comes to cancer treatment in India right now?
When the cancer happens, the family will consult several people, and sometimes they are misguided. And many times they don't know which modality will work. Even the experts, they differ. So they should follow the most common modalities, time-tested protocols. Because if you go for the high-end chemotherapy or immunotherapy, then of course that may not be available because still it is imported, very expensive. Only those who are insured they can get, or those who can afford. Because in the cancer treatment, we must see what are the common cancers, what are the common protocols, and how best they can be treated. So that will tackle 90% of your problem.
Okay. Dr. Julka?
I would like to reinforce what he has said, that everybody should get insured.
Okay.
This is number one. Because
that already Ayushman Bharat is doing to a large chunk of people.
Ayushman Bharat is doing, but for the lower strata of society, the upper strata also should get insured.
Okay.
Because all of you should get insured, because insurance is the means by which you can get optimum treatment, cancer treatment. It may not be high-end treatment, but basic treatment you should be able to get it. Because we feel miserable when we are arranging funds for somebody.
Absolutely.
And you know, maximum of my patients are through Max India Foundation, she must be knowing about, because Max India Foundation is doing a lot, you know, for poor patients. And similarly, we have the other NGOs who are doing a lot for other patients. Even in AIMS, we used to contact, no patient would go untreated. That was my aim.
So no patient should go untreated and everybody should be insured?
Should be insured.
Yeah. Rekha ji?
Again, I would come to this. Schemes are there, but are those people aware of these schemes? I think creating awareness not only about the disease of cancer, even about the facilities available must be told to the people so that they feel encouraged to come out for the treatment, you know. So those things, I think there should be some NGOs whose job should be to spread awareness about the facilities available for the people. And another thing I wanted to enforce, which is very important, that women don't come out for screening because they feel they will not be able to conceive after the treatment of cancer, which is a myth, you know. And even if they conceive, the child will be abnormal, which is again a myth. They will not have a natural sex life because so many women, they don't can go to the doctor and talk to them. They come to us. Now, can I have sex after this? Can I have baby after this? You know, and so many emotional problems in life. Will my family accept me? Is it infectious? I think awareness, I think, is the key to so many things. Not only about the treatment, not only about the screening, but also about the schemes which I have been told right now.
I think that's where the psycho-oncology factor will work really. Lalita?
I think that one of the most important things that everybody must realize is that early detection is often the cure to survival. And early detection does not mean you're going to die. One of the basic myths that must be busted is that cancer does not equal death.
Absolutely.
And that women must start learning to take care of their own health. We are taught from birth, it's a very patriarchal society, but let me not go there, that's another huge debate, where women are supposed to put everybody first in the family but themselves. What we are not told is the woman is actually the center of the family. If something happens to her, the family just gets totally splintered. I mean, it really gets badly hit. And we need to understand that women must, young girls must be taught that you must take care of yourself. It's also a duty, in a way, if that's, because if you want to look after your family, you want to have, you know, a happy life, you have to look after your health. And please go for your annual checkups. And like both the doctors here said, get insurance.
Absolutely.
Don't buy jewelry, get insurance. It's far more important.
Don't buy jewelry, but get your insurance done. So, यहाँ पे इतनी सारी महिलाएं बैठी हैं और जो ललिता जी ने कहा है आपने ध्यान से सुना होगा, तो आई एम श्योर आप अपने फैमिली में ये बोलते होंगे कि मेरा ट्रीटमेंट पहले होना चाहिए, राइट? ओके, सो हाँ, जल्दी से बोलिए.
हाँ मैम, एक्चुअली क्या है कि मेरा नाम सतिंदर कौर है और मेरे को 2 बार ब्रेस्ट कैंसर हो चुका है. तो मैं पहले भी मैंने इसीलिए समझो कि नहीं बताया कि आगे मेरे बच्चों की शादी हो पाएगी या नहीं हो पाएगी, ये बात फैलेगी तो मेरे बच्चों के जो भविष्य जो है वो ख़राब हो जाएगा. लेकिन इस टाइम चलो ऑल इज़ गुड। बट इस टाइम मैं ये पूछना चाहती हूँ कि क्या उन लोगों के लिए कोई ऐसा टेस्ट है कि आगे मेरे बच्चों को ना हो, या कोई ऐसी ट्रीटमेंट है या कोई ऐसी वैक्सीन है? जैसे एक सर्विकल कैंसर के लिए हम लोग बोलते हैं HPV है, लेकिन कोई और टेस्ट ऐसा है या कोई और ऐसी मेडिसिन है?
तो आपके इस जो प्रश्न है उसका उत्तर डॉक्टर जुल्का से लेते हैं और फिर प्रोग्राम को खत्म करेंगे। यस डॉक्टर जुल्का।
नहीं टेस्ट हैं, जैसे आपने बताया सर्वाइकल कैंसर के लिए HPV वैक्सीन है विच इज़ अवेलेबल नाउ। थोड़ा सा एक्सपेंसिव है, मतलब यू मे माइट कंसिडर, बट इट इज़ अवेलेबल एवरीवेयर इन इंडिया। एंड नंबर 2, ब्रेस्ट कैंसर का आपने बताया कि ब्रेस्ट कैंसर भी आपकी डॉटर्स हैं, अगर आपकी सिस्टर्स हैं, दे कैन गो फॉर अ रेगुलर चेकअप। जैसा कि मैंने बताया 20 to 30 years breast self examination, 30 years to 40 years clinical breast examination, over the age of 40 years go in for ultrasound or mammogram or MRI. If the breast is dense, mammogram पे नहीं नज़र आएगा, then you go in for ultrasound or MRI. So this is how we follow the routine. So regular checkups कराएंगे तो उसमें कोई फ़र्क नहीं पड़ेगा। एंड हाँ जी, क्या
सर, मैंने ये सुना था कि एक DNA ऐसा टेस्ट होता है जिसमें ये पता लगता है कि आपकी जो आगे बच्चे हैं उसमें ये चीज़ आएगी या नहीं।
वो सबका अभी हम BRCA म्यूटेशन आप बात कर रहे हैं, वो हम सबका टेस्ट नहीं कराते, क्योंकि अगर एक बार टेस्ट करा दिया और सपोजिंग वो पॉजिटिव आ गया तो उसके दिमाग में यही घूमता रहेगा, अब होने वाला है, अब होने वाला है, अब होने वाला है। सो इसलिए टेंशन नहीं देना है, स्ट्रेस नहीं देना किसी को, रेगुलर चेकअप्स कराइए। दैट इज़ मच मोर बेटर, you know, as clinical breast examination and done by a good doctor, because let me tell you, 7 millimeter lump हमने पकड़ा एक पेशेंट में, 7 millimeter, and that was just my hand went on to that lump in the breast. So this is how experience teaches you.
But the one lesson which I have learned from today's discussion is not to get scared of cancer, and that's what I think that's a message which needs to go out. But remember, with excitement building around the innovative research in cancer space, it's hard not to think of a cure. But to conquer a complicated and costly and a devastating disease such as cancer, many more major scientific breakthroughs are needed. So one needs to keep eyes and ears open, but at the same time, take all cautions when it comes to following a healthy lifestyle. Hope you found the discussion meaningful. Send us your feedback on the email ID flashing on your screen. With that, it's a wrap on this edition of The Pulse. I thank all my guests, Dr. Sudhir, Dr. Julka, Rekha, Lalitha, and this wonderful audience who took part. So thanks and goodbye.